Hello, teachers. My name is Tia Dickson. I've been a pediatric nurse for 24 years, last 16 of which have been in the ER at Primary Children's in Salt Lake City. I have personally taken care of coronavirus positive patients, but we're not seeing as many in the children's hospitals as they are in the adult facilities. And I'll talk about why that is in a minute. I'm also the nurse clinical consultant for the EMS for Children's program within the Utah Department of Health. And it's in that capacity that I'm coming to you today. I want to talk to you about your own personal protection when it comes to coronavirus. It's a gap that we've identified in the training you've already received, and we're trying to fill that gap. I am going to share my screen with you, and I'm going to try to talk quickly because I have a tendency to ramble. So we will see how this goes. First of all, definitions. The SARS-CoV-2 is a type of coronavirus pathogen that causes the disease COVID-19. But for this presentation, I'll probably be using these terms interchangeably. I have no financial disclosures, and the Utah Department of Health does not endorse any one product over another. Those pictured in this presentation are just for example. Coronavirus is a novel virus, meaning it is brand new. We don't know what we don't know. Even collecting data for this presentation was laborious because everything that comes out is basically out to date as soon as it goes to print. I'm not going to focus on the data, though I have left some of it up so you can look it over yourselves. The principles of personal protection shouldn't change. There's a lot of data out there that says it's safe to reopen schools. There's a lot of data out there that say it's not safe to reopen schools. The truth of the matter is, the data surrounding this virus is too new to get a clear picture of what's going on. But we do know some things. Children, especially under the age of 12, has shown lower transmission rates. Children who have contracted COVID-19 have had less serious illnesses than adults. That's why we're seeing less children in the children's ERs than adult facilities. Children are not dying in the way that adults are dying. We do know that COVID-19 can be very bad for adults, but most who contract it will recover. We don't yet know the long-term effects of this disease. In Utah, our case numbers and antibody testing indicate that only 1% of us have gotten it, which means 99% of us are still vulnerable. And we do know that in school settings, adults can and will transmit to other adults and children. So, are you nervous? We were. The American Nurses Association put out this survey right after lockdown. Are you afraid to come to work because of the COVID-19 pandemic? 48% of us said somewhat concerned, 38% of us very concerned, and 14% not concerned at all. When this survey came out, I was in the yellow zone. But on the first day I went back to work after the lockdown, I was in the red. I had a pit in my stomach that stayed with me for the first couple of weeks. I haven't let my guard down now, but I have learned that fear is a great motivator. It motivates you to protect yourself. And there are steps you can take to increase your personal protection when it comes to this virus. So where do you start? The first thing you want to do is gather good information. Avoid false news and clickbait, anything that would have you running down the aisles looking for toilet paper at the store. Choose evidence-based sources when gathering your information. I've listed a few of them here. Seek up-to-date information. The Utah Department of Health has just released a COVID-19 school manual that has 102 great pages of information to help you reopen your classroom. The next thing I would suggest is learning from our mistakes in healthcare. The American Nurses Association listed some of these as our early mistakes in the pandemic. We lost waves of healthcare workers to these mistakes. First, we didn't wear our personal protective equipment because we thought it was a zoological transmission from animals to humans. So we didn't need our PPE. We were wrong. You need your PPE. Then we learned we weren't using it correctly. When we were taking it on or putting it off, we were auto-inoculating ourselves with the disease because we weren't being careful. Use your PPE and use it correctly. And that is what the majority of this presentation is about. Next, we weren't requiring hospital-wide mask use. We did numbers, hospital infections and spread before we required universal masks and after. Our hospital contamination and spread dropped like a rock once we asked people across the board to wear masks. Those data numbers are the reason for our worldwide, statewide, and school-wide recommendations that everyone wear a mask. Next mistake was that we went to work ill. Doctors and nurses have to be on their deathbed to call in sick. And I know that teachers are the same. Substitutes are hard to come by, and you love your kids, and you are willing to come to work ill. But we can't do that during a pandemic. Coworkers bringing this infection with them to work spread to coworkers. Finally, we learned that we needed to stop delaying the identification and isolation of our patients. We would let them come in through the waiting area, wait in the waiting room, get back to a room, all the while exposing our hospital staff. It was when we started to identify immediately, in fact, we identify at the door, and we immediately isolate patients that might be suspicious for COVID, that we saw our hospital spread numbers plummet. This actually made the greatest impact on our numbers. So identifying sick people in your environment in the schools is also really important. And there's recommendations in the manual on how to isolate them until their parents can pick them up or until they can get rides home. But getting them and identifying them quickly is important. Door screening should hopefully help with this, but you know as well as I do, kids can look totally fine in the morning and totally ill in the afternoon. So if you see a kid in your classroom that's starting to show symptoms of illness, or a coworker, you want to make sure that they are identified and isolated. Now, if you don't remember anything else from this presentation, I want you to remember this slide. You become infected with coronavirus and a lot of other diseases through your nose, your mouth, and to a lesser extent, your eyes, through your mucous membranes. So if you protect your nose, your mouth, and your eyes, you can increase your protection against these viruses. Let me repeat that again. You can protect yourself by protecting your nose, your mouth, and your eyes. I can be in an ICU with 10 corona patients or COVID patients, and they can be spewing respiratory infection, and I can be safe if my eyes, my nose, and my mouth are protected. The same can be said of you in a classroom of 30 kids that may or may not be good at masking or social distancing. Protect your points of entry, your eyes, your nose, and your mouth. So let's talk briefly about the spread of infection. Disease can spread in a lot of different ways, but for the purposes of this presentation, I'm going to focus on 3. Some diseases are spread by droplet transmission. The infected person expels droplets that are infectious. Some of the droplets are big and heavy, they fall to the ground pretty quickly, and they dry out and are inactivated. Some viruses are smaller and lighter and can produce smaller droplets that have a wider range. Thus, our recommendation for 6 feet social distancing. Now, droplet transmission, most droplet diseases expel a collection of large and small particles, and they can be very infectious. Some infections can be very, very small and very infectious, and they can travel on dust particles and live for a long time in the air and go great distances. Those are your airborne diseases like measles or tuberculosis. These are very, very infectious. Now, what we know about coronavirus or SARS-CoV-2 is that it tends to be a droplet transmission, meaning that its infectious particles are in respiratory droplets, and they do tend to drop down around 6 feet or 5 feet. but it is capable of producing infectious aerosols. There is a tiny and very complicated difference between a droplet transmission with aerosols versus airborne. And I'm not going to get into the pathophysiology. I'm not even sure I understand the pathophysiology completely, but we do know at least that this virus can spread through droplets and that it can produce infectious aerosols. Infectious aerosols are not usually produced by talking, breathing, even coughing. They're usually produced by aerosolizing procedures that usually happen in hospitals, like intubation, deep suctioning, deep gagging. But we have seen some anecdotal studies that have shown that maybe singing or cheering can produce some of these particles. The good things for school, though, is these particles are usually in higher concentrations in places like a hospital than they would be in a school, especially if that school is wearing universal masks. Now, there's another transmission known as contact, and what happens here is these respiratory droplets land on something like your doorknob, and then you touch them with your hand. My hand can hold as many droplets as it wants and can touch as many droplets as it wants. That's not a risk to me until I take my hand and I touch and inoculate my mucous membranes. That's the trick with contact. I have to first touch it, and then I have to bring it up here. Thus the recommendations for not touching your face. It's also the recommendations for frequent hand washing and hand sanitizing, and for frequent disinfection of contacted surfaces. All of these recommendations are really, really helpful in keeping down the spread of contact transmission. What we know about SARS-CoV-2 is that it seems to be spread mostly through respiratory droplets, and that people are most infectious when they're showing symptoms and actually coughing. So if your students start to cough, identify and isolate. We do know that we are less likely to get this virus from contact contaminated surfaces. Remember in the beginning when we were all bleaching our groceries? It doesn't seem to be a big recommendation now because it doesn't seem to be as easy to transmit this disease with contact, at least as we understand it today. But hand washing, disinfecting surfaces, not touching your face, social distancing, these are the reasons that these things work. I love this picture. What would happen to this cloud of respiratory particles if this man had just pulled his mask up over his nose and mouth? It would obliterate that cloud. Those particles would stay with him. When you wear your mask, your particles stay with you, and that is one of the most beautiful things about universal masking. We keep our germs to ourselves. In the hospital, this is some of the guidance that we've received on what personal protective equipment to wear during what role, based on what role we're performing in the hospital. So over here is our role, what we're doing, and this is the recommendations for protection. You'll note that, first of all, we don't pull out our N95s or PAPRs, these are the top of the line filtered protection masks, until we are causing infectious aerosols, doing infectious aerosolizing procedures. For the most part in the hospitals, we are all wearing surgical masks. Now, these gold stars indicate where I believe a teacher might see their role. Obviously, you'll have to suspend disbelief here, because under the recommendations of our pandemic situation, you should not be having close contact with your students. You should be doing more of a forward-facing, greeting, teaching interaction with your students. Now, I know that's not going to be extremely easy. My children love hugs from their teachers. But hopefully you're not going to be involved in a lot of secretions and a lot of up close and personal care. So you'll notice that these starred areas that I think reflect some of the teacher role, all of the recommendations are the same: eyes, nose, and mouth protection. Now, I do have a friend who is an aide in a special needs classroom, and I know that you do get some direct contact, especially with those special kids. So that would be, in our case in the hospital, when we would recommend the use of gloves. And then if we're doing something with a lot of secretions, we would also add a gown. You'll notice that for the most part, those with no direct contact are not wearing gloves. Gloves are dangerous unless you use them correctly. And remember, when he talked about contact, you can be in a room full of virus. Your hands can do whatever they want as long as your eyes, nose, and mouth are protected. Once you come out of that room, you'll want to hand sanitize or wash your hands before touching your protection. But ultimately, glove use makes the wearer feel safe and comfortable when in fact they can easily contaminate the environment. So gloves are not recommended except in direct patient care where you're involved with secretions. And in some cases that is teachers, but you will have to go with your facility recommendations on what to wear in those cases. So let's talk about masks. This is an N95. The 95 means that it filters 95% of tiny little particles like viruses. So you'll note, first of all, that that is not 100% protection. It's 95% protection. And only if it completely seals around my face. So how do we decide if this is a good fit for us? In the hospital, we have to go through yearly fit tests for our N95s. They put this shroud on us, they spray pepper spray into it, and they have us turn our head from side to side, up and down. They make us recite a poem using our jaw. They even have us bend over at the waist. And if we can perceive the pepper spray, we have failed our fit test. For years and years and years, this was the main N95 mask in hospitals, and I always failed. In the last 2 years, they've come out with a new style that I've actually passed, but an N95 is only as good as the seal around your face. For the majority of our shifts, we wear procedural masks, these ones, and this is me on my shift. These masks do not seal to the face, and they do not filter as well as the N95s. There's a lot of different research on how much they filter. The highest I've heard is 75% of virus particles. But again, they don't seal to our face. So the protection from this mask is less than this and more similar to what they've asked you to wear. These used to be one-time use. I used to throw them away very casually. Now we are being issued one of these masks for a 12-hour shift. We wear shields over the mask to keep them clean and to prevent us from spreading things from patient to patient. I will disinfect this shield in between each patient encounter. But when I put that mask on, and I do it at the door of the hospital, and the goggles, I don't touch my face mask or goggles again until my break, which is usually 4 to 6 hours into my shift. Those stay on at all times. I don't remove them for the bathroom. I don't take them off when I'm in the supply room all by myself. I don't touch them until my break. The shield I wash between patients, and I may take it off while I'm documenting, but that is to keep the mask clean and so that I don't spread anything to my patients as I go from room to room. These are in incredibly short supply, which is why we're already rationing them. These are hard to come by, and that's why the CDC has asked that you not purchase these masks, but rather wear cloth masks or face coverings instead. Again, these don't seal to our face. These don't seal to your face. So the filtration is, or the protection is roughly the same. One advantage these do have over these is that they tend to be water resistant. But cloth masks provide some protection. Some manufacturers of cloth masks now are claiming that they can provide 100% protection. They may even eventually be better than what we have in the hospital. But wearing cloth masks can increase your protection, mostly from preventing you from touching your nose and your mouth. It's a barrier, and it prevents you in that contact situation from touching and contaminating your nose and mouth. It keeps your germs to yourself, and there are studies coming out every day to show that it does provide some respiratory protection as well. It depends on the mask as to how much, because not all masks are created equal. The CDC recommends at least a 2 to 3 layer cloth mask with ties or ear loops. Here is a list in the corner of their specific recommendations. They have patterns on their website. The candle test went viral, and it's a good rule of thumb. If you can blow a candle out wearing the mask, it's not sufficient protection. But there are all sorts of masks out there on the market. What about masks with filters or filter materials? They have them where they have the envelope and you can slide a filter in to increase the filtration. They're even coming out with materials now that are filter materials. Those are fantastic, but remember, your filter is only as good as the seal around your face. If the mask is ill-fitting, it doesn't matter how much filter ability it has. Now, there are some masks that are ineffective. These are masks with exhalation valves. These were created for cancer patients to prevent them from getting anything from others, but they allow the person wearing it to expel their air from the mask, which in the pandemic is not what we're looking for because we want to keep our germs to ourselves. These are banned in hospitals. The neck cloth is also not really scientifically supported. If you have this thing filtering respiratory infectious particles and you pull it down and let it hang at your neck, those particles are apt to bounce off and into your mouth. Same thing with if you're taking it off at the end of the day, you're pulling it right across all of your nose, your mouth, and your eyes, and can easily auto-inoculate yourself. The most important thing about a mask, though, is that you have a good fit and it's comfortable. And that's far more important than what it's made of. Studies have shown if you're not comfortable in your mask, you're not going to wear it right, or you're going to be adjusting it all day long, and that's not safe. Comfortable, well-fitting. Mask safety is important. I love these pictures here. Is this protecting your nose? Is this protecting anything? Not at all. When you wear a mask, it should cover your mouth, nose, and chin. Here's an example. It should be easy to remove safely with ear or ties and put on safely so that you're not having to touch or adjust the main part of the mask. This part facing out is considered dirty and contaminated once you've started using it. So one thing you want to make sure you can do is tell the difference between the dirty side and the clean side. If your mask is the same on both sides, you may want to mark your dirty side so that you know at all times. You do not want to pick it up accidentally and put the dirty side to your face. You also don't want to touch it. It's always interesting to see folks come out of a grocery store with this on their face, and then they yank it off, they ball it up, and they stuff it in their pocket. I've contaminated my hand. I don't know where my dirty and my clean side are anymore, and that is a way to spread the disease. You always want to protect your side. When I take it off for break, as pictured here, I remove it safely, I set it down on a clean surface or a paper towel, and then I eat my lunch. Hand hygiene is performed before and after I touch my mask. And that's really, really important. When we in the hospital are having our break, we set it down in someplace safe and flat. We perform our hygiene, we eat our lunch, and then we immediately put it back on. We don't want to spend a lot of time in our hospital environment without it on our face, without the protection that it provides. The other thing you want to consider is changing the mask if it's dirty or wet. I said earlier, these procedure masks are water resistant, which makes them good for the entire 12 hours. But cloth masks are going to get wet through the humidity of your breathing. If I were in your situation on an 8-hour class day, I would bring several masks that I could trade out to keep nice and dry, because when these get wet, their filtration ability decreases. As far as laundering goes, if you only have one mask, you should be washing it daily. Remember, days of the week underwear, you may want to have several masks for that purpose. Washing recommendations can be found on the CDC website. They have bleach concentrations as well as recommendations for laundry detergent. Hot water for 10 minutes is what I believe they're recommending. Just as an example, I have a bunch of clean masks hanging at my door, and I have a dirty bag for masks, or a mask for dirty masks also at the door. My family will take clean masks with them. As soon as they come back, they put them in the laundry basket. No one plays with that laundry bag. And that's one way to keep it safe. Another thing while you're out shopping, sunlight deactivates viruses very well. So if you can find a place in your car to set your mask in the sunlight, rather than letting it hang from a rear view mirror, when those respiratory particles can be bounced right off and into the air and into your face. Never hang a dirty mask from the rear view. If you run into me at the grocery store, you will see clean masks hanging from my rear view. So please don't come up to me and judge. But definitely be careful with your mask. It's not a casual thing you throw on and throw off whenever you like. Its purpose is to protect you, to keep your germs to yourself, and to prevent you from touching your face. So it serves 3 good purposes in this pandemic. Trust your masks. Eye shields are another subject. When I first started putting this presentation together, eye shields were not universally recommended. On July 31st, Dr. Anthony Fauci said you have mucosa in your nose, mucosa in your mouth, but you also have mucosa in your eyes. Theoretically, you should protect all your mucosal surfaces. So if you have goggles or eye shields, you should use them. Schools will have different recommendations. In theory, if everyone in your school is keeping their mask on and maintaining their 6 feet distance, eye protection wouldn't be required. But in the hospitals, we're wearing them. We all have either goggles or eye shields. For folks that wear glasses, these were recommended for hospital workers. They protect the sides as well as the front. In the hospital, it is not sufficient for us to just have the front. We have to have side protection. They're also offering face shields as eye protection, and this is a good option. But remember, face shields currently by CDC recommendations do not protect your eyes or your nose and mouth sufficiently, and so you should always have a face mask on with a face shield. And I know you see it in the grocery stores, people using just face shields, but current recommendations say that is not sufficient. Don't worry. The market is coming out with all kinds of different options. They are even advertising sexy face shields. Of course, this girl needs her mask in place. Now, prolonged PPE use has its hassles, and we have come up with some tricks and tips we want to share with you. One thing is ear pain. When you have the ear loops or the goggles on your ears, the ears will become irritated very quickly. So one of the things that has become really popular is to get headbands and sew buttons in place. This is one of our ED attending physicians, and this was taken a couple of days ago. We are still using our bandana and buttons in the hospital on a daily basis. There's been all sorts of things that have been 3D printed to help with ears. And you know, you can find just about anything to do this, but remember you do have options because your ears will get sore if you're wearing your masks and committing to them. When you wear goggles or glasses with masks, fogging is an issue, and believe me, we have tried everything. The most effective thing we have found for our staff has been to use some hypoallergenic, gentle surgical tape and tape the area under our eyes. That prevents fogging and also helps with dry eye. You'll notice my eyes are a little red already because I hadn't put the tape on, and I was starting to feel pretty dried out. So I went in the bathroom and put the tape on, and I did better through the shift. Dry eyes is another one, and mask acne is a thing. One thing to note though, if you are using either of these kinds of products, you have to be safe. You go into a safe area where you can safely 6 feet distance from others. You wash your hands, you remove your mask and your goggles. If you're washing your face with a towelette or something to refresh your skin, always wipe from your clean mucous membranes out first. With a clean cloth out first. Then you can wash as you would normally. But that first swipe needs to be from clean to dirty. Same thing with eyes. Make sure that you've done really good hand washing. Remove your mask and goggles. Do another good hand washing, and then you can put drops in your eyes if you need them. If you're having consistent dry eye issues, talk to your doctor. Now, even correcting all the mistakes that we talked about earlier, we still have some hospital spread, especially among coworkers, and they've done some investigating, and they've really identified 2 areas in which we continue to spread. One is the break room. 2 is socially interacting with one another outside the hospital. We throw all of our precautions to the wind as soon as we get out of our environment, and we're still friends with one another, and we spread it socially. Be careful socially. But also be very careful in your break room. You think that you're safe, that's your space, these are your people, this is your family. And so we tend to put all of our precautions aside. And we're seeing spread among coworkers in the hospital because of this. So this is an infographic provided by Intermountain Healthcare that is in your toolbox, along with all the other infographics I'm going to be going over. Read through these. They will increase your personal protection. What else are hospitals doing? We're restricting visitors. The less people you have in that environment, the less they're going to be increasing respiratory droplets. Screening at the door has been important in hospitals, and it's not just visitors or students, it's staff too. The questions that we're asking are very important. We used to take temperatures, and science actually has shown us that temperatures may not be a great indicator of illness, so we have stopped taking temperatures. Some of your schools may still be doing it, and you know as well as I do that fever is a good indicator that a kid is sick. So it's something that you would want to follow your facility recommendations on. But the questions are what is important. Have they had fever, respiratory symptoms, or congestion? Have they had nausea or diarrhea? And have they had a loss of taste and smell? The loss of taste and smell is actually showing up to be a somewhat cardinal symptom of COVID-19. Some reports are even saying it's as much as 87%, even in mild cases. So it's one you definitely want to focus on in questioning. Then we require every single person coming in to hand sanitize as they walk through the doors. And then we put our masks and goggles on, and we keep them on across the board throughout the day. Every person in the hospital. One of the most important things you want to think about is transitioning from work to home. None of us wants to bring any of this home to our families. So this is recommendations from our Intermountain Healthcare. When you are getting ready for work, you want to remove anything that's going to capture those respiratory particles. So watches, jewelry, anything like a lunch bag that you bring in and take out of that environment back and forth. You want to decrease the amount of things that you're bringing in and out of the potentially infectious environment. This one says to wear different clothes to work and then change your clothes. Of course, we wear scrubs in the hospital, so that's our recommendation. I wear my scrubs to work, but I do bring personal clothes in a bag and I change into them before I leave the hospital because I don't want to carry particles into my car. You want to use proper hand hygiene. Then during work, you want to disinfect throughout the day, especially anything that's on your body. Our ID badges, our eyewear, stethoscopes for our hospital folks, but anything that you're carrying with you, and then you want to disinfect your high touch contact areas. And again, that manual that they've just put out gives you some fantastic lists of what those areas are. You want to make sure that you avoid direct contact with others, avoid handshaking and high fives, disinfect your lunch areas before and after eating, practice the social distancing, and then wear your PPE as directed. When you're leaving work, and I like this, take a minute to reflect on things that went well. Wellness is a whole nother subject that could be hours worth of discussion. I don't have any specific resources here because I know there are so many of them at your fingertips, but pay attention to your personal wellness during this pandemic because we have seen such a spike in depression and suicide and domestic abuse and child abuse. We need to take care of ourselves. It needs to be priority. Then you disinfect everything that you're carrying out with you. We put our clothing into a bag, wear clean clothing home, and then as soon as I get home, I leave my clothing outside. I go straight to the shower and take a shower before hugging my children, and then I take my clothes down to the laundry and wash them. This is not necessarily a recommendation of what you should do. This is what I do. And I have high-risk people at home, so that I have more incentive for doing this. I'm a high-risk person myself, in fact. So this is what I do. And we're sharing this information with you to give you options. Your environment is not got as many infectious respiratory aerosols in it, hopefully. But these are ways you can increase your protection. Here are some ways to increase your family's health and safety. And when we first locked down in March, everyone was doing these things. But we are now experiencing caution fatigue. Everyone is sick of this pandemic. I am sick of this pandemic. But we need to get back to the basics so that we can protect our families. Unfortunately, Dr. Fauci recently said, our chance of getting coronavirus now is far greater than it was in January through March because it's here. Frequently asked questions, the better ventilation you have in your classroom, the better off you will be. Those respiratory particles need to go somewhere, and the faster they can get out of your room, the better. There are options besides toxic chemicals. The EPA lists things that are safer, have safer active ingredients, and I've done some of my own research listing things that might be safer for children. So you might want to do some research into what you're using to disinfect your classrooms. Another question I've gotten often, when will all this end? Historically, pandemics can last for decades, but since the 1900s, they usually average 2 years. So we have still got quite a ways to go. There are 4 US vaccines that are promising. 2 should be available within the next 6 to 8 months. But again, that could change on a day-to-day basis. When you have a chance and with your loved ones, I highly recommend watching these 2 videos on YouTube. Take a picture of this screen with your cell phone. These videos give you a very concise but scientifically based understanding of the spread of this virus. And you will be better for understanding that. In summary, the data available right now suggests that children are less likely to get COVID than adults. When they do get it, they have less serious illnesses, and they don't seem to spread as easily as adults. But data is changing every day. So you want to seek out current information and evidence-based information. You want to protect your points of entry, the eyes, nose, and mouth. And you want to develop good habits surrounding your socializing, when taking a break and when transitioning home. Is this perfect protection? No, we don't have perfect protection in the hospitals either. But can you take steps to increase your personal protection when it comes to being in your classroom? Yes. Can you be safer in a classroom full of 30 kids that may or may not be masking and social distancing? Yes. It's not perfect, but you can increase your protection. Thank you to Intermountain Healthcare for helping us to put together for making the information available so we could put together this toolkit for you. Thank you to teachers for all that you do. You are incredibly, incredibly essential. And thank you for listening.